Extract 1. Questions 1 to 12. You hear a general practitioner talking to a patient called MIHIRAA. You now have 30 seconds to look at the notes.
Good morning, MIHIRAA. Please have a seat. So, you mentioned wanting to discuss some ongoing issues you've been experiencing. Can you tell me a bit more about what's been bothering you?
Hi, Dr. Wright. Thanks for seeing me. It's been a real struggle lately. For the past 6 months or so, I've been feeling this overwhelming fatigue. It's not just tiredness after a long day, it's a deep exhaustion and fatigue that lingers even after a good night's sleep. I wake up in the morning feeling like I haven't rested at all. It's starting to interfere with my daily routine and overall quality of life. I also have this constant dull ache all over my body. It seems to shift around, from my neck and shoulders down to my lower back and legs. Sometimes, it's a sharp pain instead, especially in my joints. There are days when it feels like my entire body is inflamed. I've tried over-the-counter painkillers, but they don't seem to make a significant difference.
Have you noticed anything that seems to trigger these aches or make them worse? Stress, perhaps?
It's hard to say for sure. Stress can definitely make things feel worse, but honestly, the pain seems to come and go on its own a lot of the time. I also have trouble sleeping deeply. I wake up frequently throughout the night feeling restless and uncomfortable. It's not just the physical discomfort, it's also this sense of anxiety that's hard to shake off.
Those are all valid concerns, MIHIRAA. Have you experienced any other symptoms besides fatigue, aches, and sleep problems?
Well, now that you mention it, I do have these strange headaches that come and go. They're not migraines, but they're dull and make it hard to concentrate. On top of that, I've been feeling forgetful and foggy-headed lately, which is really frustrating. It's like a mental cloud that makes it difficult to focus on tasks or remember things, even simple ones. I find myself struggling to keep up with work and everyday responsibilities.
Interesting. And how has this been impacting your daily life?
It's been incredibly difficult. The fatigue makes it hard to get through my workday. I used to enjoy going for walks and socializing with friends, but now even simple activities leave me drained. It's affecting my mood too. I feel down and discouraged most of the time. I've started to withdraw from social activities because I'm worried I won't have the energy to keep up. It's isolating and adds to the stress.
It sounds like you've been dealing with a lot, MIHIRAA. Based on your description of the widespread pain, fatigue, sleep issues, and cognitive difficulties, I suspect you might have a condition called fibromyalgia.
What? I haven't heard of that before. Can you tell me more about it?
Certainly. This is a chronic condition that causes widespread pain and tenderness in the muscles, joints, and soft tissues. It can also lead to fatigue, sleep problems, headaches, and difficulty concentrating. While the exact cause is unknown, it's thought to be related to abnormal pain processing in the nervous system.
That sounds very similar to what I've been experiencing. What kind of treatment is available?
Unfortunately, there's no cure for the condition, but there are treatments that can help manage the symptoms. This may include medication like pain relievers and sleep aids, physical therapy to improve flexibility and strength, and exercise programs specifically designed for people like you. We'll also discuss strategies for managing stress and improving sleep hygiene.
That's a relief to hear. I'm willing to try anything to feel better again. The idea of having some form of management gives me hope. I'm ready to make changes and follow any recommendations that might help alleviate these symptoms.
Excellent, MIHIRAA. We'll discuss a treatment plan in more detail after I perform a physical examination and possibly some blood tests to rule out other conditions.
Extract 2. Questions 13 to 24. You hear a physician talking to a patient called MIHIRAA. You now have 30 seconds to look at the notes.
Good afternoon, MIHIRAA. You mentioned in your message that you've been dealing with some health issues lately. Can you tell me more about what you've been experiencing?
Hi, Dr. Parker. Thanks for seeing me on such short notice. For the past few weeks, I've been feeling really off. It started with this strange rash that looked like a bullseye on my leg. It didn't go away as I thought. Instead, it started spreading outwards. At first, I thought it was just a regular bug bite. During this phase, as I told you earlier, I started feeling really tired all the time. At first, I thought it was just because of my busy schedule, but then I noticed I was getting headaches and feeling dizzy. The fatigue is overwhelming. I can barely get through my workday, and when I come home, I just crash on the couch.
I see.
Now, doctor, I'm also experiencing joint pain, especially in my knees and elbows. The pain is pretty intense, and it's making it hard for me to move around. Even simple tasks like climbing stairs have become challenging.
Well, MIHIRAA, have you had any fevers or chills?
Yes, actually. I've had a few bouts of low-grade fever and occasional chills. It's been really frustrating because I can't seem to shake it off. The fever isn't very high, but it makes me feel really uncomfortable and achy. The chills come and go, and sometimes they're so bad that I have to wrap myself in blankets even when it's not cold. It's really affecting my ability to focus and be productive.
That sounds concerning. When did you first notice the rash, and how long has the fatigue and pain been going on?
I first noticed the rash about a month ago after a camping trip. I didn't think much of it at first, but then it started growing and turning into this stage. The fatigue and joint pain started a week or so later. Initially, I thought it might just be from overexertion or maybe I caught a cold, but it hasn't gone away. In fact, it seems to be getting worse. My knees, elbows, and even my hands are sore. The fatigue is relentless. Some days, it's a struggle just to get out of bed. It's like my body is constantly weighed down by this invisible force.
I see. MIHIRAA, have you noticed any other symptoms besides the headache, joint pain, and fatigue?
Yes, I've also noticed that my sleep is disturbed. Even though I'm exhausted, I can't seem to get a good night's rest. I wake up multiple times feeling restless. My memory is also shot. I've been forgetting simple things like where I left my keys or important tasks at work. It's really frustrating and a bit scary.
That sounds difficult, MIHIRAA. Given your symptoms and the rash, it's possible you might have Lyme disease. The disease is an infection caused by the bacteria Borrelia burgdorferi, typically transmitted through the bite of an infected black-legged tick.
Well, I've heard of it, but I didn't know it could cause so many issues. What kind of treatment is available?
Yes, it can cause a range of symptoms, particularly if not treated early. The good news is that it can be treated effectively, especially if caught early. Treatment usually involves a course of Septin depending on the severity of your symptoms. The duration of the antibiotic treatment can vary. We'll also focus on managing your symptoms like pain and fatigue in the meantime.
That's a relief to hear. I'm ready to start any treatment necessary. This has been really tough to deal with.
I'm sure it has been, MIHIRAA. We'll run some blood tests to confirm the diagnosis. Western blot test and ELISA. These tests will check for antibodies to the bacteria that cause the disease. Based on the test results and the symptoms you've described, we'll start you on a course of antibiotics and Ritalin for fatigue. I'll also recommend some strategies to help manage your fatigue and pain. Please adhere strictly to the medication regimen and make any necessary lifestyle adjustments.
Thank you, Dr. Parker. It's reassuring to know that there's a plan in place and that what I'm experiencing has a diagnosis and a treatment.
That is the end of Part A. Now check the answers.